It is Bennett from the new 96.5, and I'm so happy to be joined with my friends at the Philadelphia Department of Behavioral Health and Intellectual Disability Services. You've heard me talk about this on the air each and every morning, the importance of mental health. Of course, you've heard, my backstory and how I've gone to therapy throughout my entire life and how, speaking about your mental health and being open about it has really helped me throughout my entire life. And I'm just so happy to have you guys on here, this little 9 and 8 podcast. We have Marjola here, the interim manager of Philadelphia Crisis Line. Good to see you this morning.
Good morning. So nice to be here. Thank you.
Yeah, absolutely. We have Patrick, the mental health emergency supervisor with the Philadelphia Crisis Line. Good morning, Patrick.
Good morning. Good morning.
And we have Raquel, the systems integration specialist. Good morning.
Good morning.
How we doing?
I am well. How are you?
I'm doing great. Thank you for
Good.
asking. Before we get into the importance of mental health and speaking about it and the 988 program in general, kind of just a little backstory about yourself and your role and how you got here. Marjola, you want to kick us off?
Yeah, of course. Good morning. I am Marjola Como. I'm the interim manager for the local suicide line for Philadelphia. I've been with the Department of Behavioral Health and Intellectual Disabilities for about 11 years, but I've been in the mental health field for about 20 years now. I am a licensed professional counselor and I'm also a registered nurse. And I love being here to talk about 988. Thank you for having me.
Of course. That's amazing. Patrick?
Sure. My name is Patrick Dunn. I am one of the supervisors for the Philadelphia Crisis Line. Um, I've been with DBH for the past about almost 20 years. Um, First, I was at a different capacity for 16 years, and then I joined PCL for the past two. But there is actually about 20 years in there somewhere. Math is hard. Uh, I used to work as a teacher in the Philadelphia School District, um, and I have a background in education, I am in mental health since the age of 19, so a very long time. And I too think it's very important to talk about mental health.
Yeah, I feel like over the years we've been able to have that open dialogue a little bit more and more, right? It's definitely growing since, when I was a kid, when no one really talked about mental
Mm.
health. And Raquel, tell me about your story and how you got here.
Sure. So I am Raquel. I'm a person in long-term recovery. So I have close to 8.5 years in recovery. So I started with the department about 5.5 years ago. I actually, prior to working at the Department of Behavioral Health, I worked as a recovery specialist for a recovery community center in Philadelphia. That was how I started in the field. And then I started at the Department of Behavioral Health as a certified peer specialist. So currently, I work in a macro level role in the commissioner's office. I am part of my role is I am a subject matter expert. I also when I was, using substances, I had engaged into treatment through the Philadelphia Medicaid system. So I had contact with us, with our system that we currently work in. And that's why it was so important for me when I came into recovery to work for that system. And specifically to work with folks that are at poverty level and, with Medicaid because that's who I am, right? Like that's who I was. That will always be part of me.
Mm.
I'm a Philadelphia native, as you can tell in my accent. Hopefully you can understand me. And I speak really fast. Um,
That's the best way.
might be the double espresso too. But yeah, I'm a Philly native. So it's really important for me. This is what we do as a department is so important to me because I love that we are talking more about mental
Mm.
health. However, the stigma is still very alive and well. So for me, like I feel like my personal crusade in life is to let people know that, it's okay to own who you are. That like my mom and I always say, like we had to go there to get here. And I always say I have no regrets in life, and I really don't. I only have lessons learned because those things made me who I am today. And I just think it's really important for people to know that it's okay to have struggles and challenges. You don't have to be embarrassed because there really is so much help out there. And my experience has been like, you never know when you're in a room of people and you open up about this, who else is experiencing it and how it can help others.
You're not kidding. It's so real how many of us are holding on to something and kind of suffering in silence, right? We're all kind of holding on to something heavy. And when you open up about it and be transparent, it's
Mhm.
amazing. It's how many people are dealing with maybe similar things. Just myself alone, this past year, my wife and I had dealt with a lot of struggles in our family. We went through two miscarriages after
Mm,
20 weeks,
mm,
and you think like no one else has been through this, right? And when you start opening up that dialogue and talking about it, so many families have been dealing with this, right? It's a hard topic to really get into, but like what you said, you talk about it, you open up. Not only is it healing for yourself, but you realize that a lot of other people, whether it be friends, family, colleagues, have dealt with similar situations. Have you felt that way as well?
Life is hard. Life can be challenging. We experience losses, we experience grief. So yes, everybody needs help from time to time, and that's why we have 988. Anyone can call 988 for any mental health crisis. If you're dealing with anxiety, if you're dealing with depressive symptoms, if you're dealing with grief, with loss, for any other crisis, you're going to be connected with someone who's there for you and is going to help you. So yes, I have felt the same in my personal life as well.
And you would get someone like Patrick on the line, right? And so walk me through how to, if I were to call 988, walk me through kind of like how that would be.
So, we have multiple language support. So it's not just for English speakers. 988 has access to a language line. So we can connect you to a language that you're comfortable sharing your thoughts and feelings with a translator. Will translate to us in real time. So any language is available to us through our language line support. So not just English, not just Spanish, the whole gambit.
All are welcome.
All are welcome. You could either call or text 988. And if you call, you're given a choice of choosing a veterans line or an LGBTQ line. Uh, and that is, to make sure that you get the support that you're really looking for. But of course, we'll talk with everyone, right? So, um, you would, you would be greeted. Hello, this is Patrick. You know, how can I help you? And then, you might start to share your story, and then immediately, I would look for a way to connect with your
Mm.
story, and I'm, generally interested in your story. So any of our counselors are really going to listen, and what's important is that, that there is that connection, and folks will begin to, you can actually tell right away because how they started the conversation, is not how they end it.
Mm.
And it's usually in a much more positive, people feel, even though their problem isn't necessarily gone,
Sure.
but they have got that big relief, that release of like, I'm not carrying this by myself anymore. Someone else has heard me.
Hmm.
Someone hears me
And
y-
gets it.
and
Yeah.
gets it and gets it. And that's the thing too, is that many of us have had loss, and we can use that connection, but we're also trained counselors too. So we have that therapeutic line, that professional line, but we also are aware that we know what it's like to carry a secret. We know what it's like to carry pain, and we know what it's like to suffer through depression. But we also know what it's like to recover.
Mm.
And that's like the biggest part too, is that when you're holding on to that stuff, you don't ever think it's going to be different. And then it is. And then you can take those steps forward, and then you can actually see that recovery come through. And that's beautiful.
Isn't that a beautiful thing?
It's a beautiful thing.
Raquel, you can speak to that, right? I mean, being on the other side of it, because when you're in it, it is so tough to see that light, right?
Mm.
Uh, how you spoke about that, Patrick, just having that release, getting it off your chest. I've been there before where, like, just having someone on the other line listening is just so therapeutic in itself, you know? And then, like you said, not the problems are gone, but you've been heard. And just that alone kind of like takes the burden and weight off your shoulders. And then when you get to the other side, how beautiful is that? Finally seeing the light.
It's amazing, and I can completely relate to that because when you're in the middle of it, like, I remember just feeling like, "Alright, my only way out is death."
Mm,
Um, Everything just seemed so hard, like, how am I going to even clean up my past and get move forward and, all of these things, and, for a very long time, I thought that if I had all these external things, that I would be okay, and then I would get the external things quickly, but I was never okay, right? So, like, I really feel like what I suffer from is that I want more of everything, but then it doesn't fill me.
right.
So, in entering into recovery, other people in recovery and even like, counselors taught me that what I actually have is this internal condition and like external things don't heal my internal condition. And when, you do some of this work on yourself and, with the help of others, I always, still need people to hold my hand
Sure.
and remain in the middle of recovery. But it is amazing when the light comes on and you're like, wow, like I always say I feel like I live 2 different lives, and I'm grateful for both of those lives
Hmm.
because, um, it is just so powerful of being on this side and thinking and seeing, like, the way I process things, like, checking my motives and, most of all, being in service, helping others, like, that's the highlight, and then watching that light come on for another person is, like, even
It's
more,
gonna be
like,
so rewarding.
powerful.
Yeah, yeah.
Yes, it is. Yep.
It's
That's why talking to someone when you're feeling like that, it can save your life. So it's very important to understand that nobody is alone, that you have options. And making that decision to call 988 and to connect with someone on the phone, it might be the most important decision of your life.
I think that might be the hardest step for someone, right?
Yes.
Just picking up the
Mm.
phone, calling or texting. But once you get over that hurdle, right? Because I've been there
Hmm.
before where it's like it's hard to open up and you've been carrying it for so long. How could I possibly talk about it now, right? But once you do, it's like ripping that band-aid off and you start that process of healing, which you all spoke about. You mentioned the only way out was death. And I'm sure so many people have felt that way, myself included, where you feel so stuck, so in it
Hmm.
how could I possibly get out? And I kind of want to speak more about this, especially with the holiday season. I know that can really be a terrible time for a lot of people. We think of the holidays as bright and joyous, but for many of us, that's not the case.
Yeah.
Just talk to me about this time of year and how important 988 is.
Well, there can be so many triggers for people when the holidays come. Families sometimes can be supportive, families sometimes can be triggering. So it's important to understand that when you call 988, you're going to get someone who's trained, someone who's not going to judge you, someone who's going to connect with you and be there with you and understand the situation and collaborate with you to come up with a plan so everything doesn't feel so overwhelming.
Mm.
Yeah.
Um, Patrick, you can speak to this
Yeah,
too.
I was gonna say that, like, for instance, a transgender individual may be isolated from their family. They know everyone's going to the family for a celebration, and they're not invited. And that person may feel really, really horrible. They may feel suicidal, and they can call 988, and they can talk with staff who are trained, to talk about that and to listen and to provide support. Folks that, who, may not have presents to give their
Mm.
kids, or, folks that, have losses, like when you have, if there was a death in the family, and it's like in the first beginnings of that, of the holiday season,
Mm.
it's the first season without them, brings up a lot of feelings.
Or the
Uh,
anniversary of,
yeah,
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 it's very
anniversaries are
triggering.
very triggering. So we get calls from folks around this time because of those triggers, and like Marjola said, it's like once you just get that off your chest, you can get that support, and that decision that you were thinking about before you made the call, you're making a different decision at the end of the call.
Yeah, it's a huge first step. Now tell me, what's the difference between calling 911? Because, if you're in a panic, if you're having these thoughts and your mind is racing, the difference between calling 911 and 988, you know?
So 911 is for physical emergencies. If your life is in immediate danger, if there's a crime being committed,
Mm,
988 is for mental health emergencies. So if you're experiencing a panic attack, if you're experiencing depressive symptoms, suicidal ideations, then you call 988. Um, the biggest difference is when you call 911, you are going to get a physical response, usually police officers responding to the situation and helping you. 988 doesn't necessarily do that. You're going to get a 988 counselor who is going to ask you questions, make sure that there's no immediate threats to your
mhm.
safety, and talk to you. We do have the option to dispatch mental health mobile teams who can help you face to face, but that's not necessarily the first step. So that's the biggest difference between 911 and 988.
Sure. And why did it go from the 10 digits to 988? I'm assuming, it's so much easier, right? I mean, is that the main purpose?
The Yeah,
Yeah.
so the National Suicide Line has been helping people since 2005.
Mhm.
And back in July of 2022, they decided to switch to 988. One of the main reasons is when you are in mental health crisis, it's very hard to remember a 10-digit number.
Sure.
So 988 is easier to remember. And for also for elderly people who are not able to remember a 10-digit number, 988, it's easy, it's quick, and you're going to be connected immediately with a 988 counselor.
It's also quick for kids too, because it's not
Hmm.
just adults who are calling us. We have children who are in crisis. We have teenagers in crisis. 988, it's published everywhere. It's easy to remember. They can text, because we know of kids of a certain generation, heaven forbid you actually have a phone conversation, but I'll text you, and that's an important
I was
feature.
I was gonna bring that up. I mean, how great is the text feature for this? Because, like you said, this day and age, it's hard to pick up the phone and talk to someone you do know, let alone maybe a stranger on the other end, especially about something as heavy as this. Texting has got to be a really great component for this. Yeah.
Yeah.
Um, this has been so great to have this open dialogue. Anyone have anything else that they want to share and kind of get out? Raquel, anything that you want to say?
So yeah, I just want to mention that I definitely agree with you that holidays can be rough, and especially like for people in recovery and anyone really, because unfortunately sometimes there's a lot of death around the holidays, and sometimes there is um just a lot of feelings, especially like if you're in recovery, like there's a lot of alcohol at family parties or just parties in general, celebrations, and I think that what's so important is just to like, keep in mind that these are, like, only events, right? Like, something that I was taught and that has helped me throughout the years was, you play the tape through, right? And you think about, like, well, all right, I get it that this is an event and this looks really good right now, right? But what will happen if I do this, like, next week, right? What will happen if I do this? How am I gonna feel tomorrow when I wake up? How many people am I gonna hurt? How bad am I
Mm,
gonna hurt myself, right? And that has been a tool that has helped me tremendously, and of course talking about it, just to echo what Patrick mentioned, getting it off of your chest is so important. I mean, I know after I have something bothering me, and a lot of times it's my head making all these different scenarios up, and I just get it off, and I have someone that I trust, or someone that I don't even know. So I'm like, I don't really care who they tell because they don't know me either,
sure.
but
Yeah.
I need some feedback. It's so important, and you get it off of your chest, and I literally feel like it just goes away, you know? Or and especially when I get constructive feedback, then I
Hmm.
feel like when it comes up again, I know a little bit better how to handle that. And I just want to reiterate like the importance of asking for help. It is so important. It is so hard. It's harder for different populations, but I know like for me, what was the hardest part of asking for help was that I was so angry with myself, and I thought for a very long time that all of these other people had wronged me, and that I was so angry with them. But then when I asked for help and in doing some work, I realized that the biggest person I had to forgive was me. And once I forgave me, the 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 way my recovery blossomed was it was phenomenal. And the way I forgave me and just allowed myself to be me and to tell myself like everything's okay.
Right.
You made some mistakes, but you're not a bad person. We can move forward from this. And literally just like that positive self-talk. I hadn't realized that um I had hurt myself the most and that I kept hurting myself because my self-esteem was so low and I just couldn't let myself off the hook, essentially.
Right.
And once I did, it was like, wow, like it was just powerful. And like the blessings upon blessings, started pouring in. So I
Because
think that's so important to tell people.
yeah, because one thing doesn't define anyone, right? Like our past does not define us.
Hmm.
It was just so important to talk about because my first instinct when I'm going through something is to self isolate. I am
Mhm.
the
Mm.
LeBron James of isolating myself from friends, family. When something is going wrong in my life, I kind of just like disappear. And I kind of now, after going through therapy my whole life and, coming up with different coping mechanisms, like I'll realize what I'm doing, I'm like, okay, this is not healthy. And so I'll start reaching out and saying yes to plans, right? I'll start talking about what I'm feeling. And I start to feel myself coming out of that, right? But my first instinct is to like, right? And I feel like a lot of men do that. A lot of men will hold on to whatever is that they're feeling.
I want to mention that actually. It's like that as a man, I'm expected to power through it,
Hmm.
right? I'm
Sure.
expected to, not talk about stuff, not reveal stuff,
Keep it moving.
keep it moving, keep it moving. I don't have time, or if I start getting in there, I'll really get in there,
Right.
and it'll be overwhelming. Once I open the floodgate, then there's nothing. Nothing's going to hold it back.
Yeah, I always felt like in the past that I would be burdening a family member or
Yeah.
a friend with my own problems because I know that they have their problems. So why would they ever? But they do care because I
Hmm.
know I care about hearing a friend or family member what they're going through. So
Hmm.
I have to remind myself of that as well. It's okay to share. It's okay to open up because what we've said before, the person on the other side might be dealing with something similar,
Mhm.
and now all of a sudden you are uh, closer to one another because of this, right? I've found that in my past as well. Like silly me, I've been holding on to this, but now that I've opened up, now we have something in common. We have, similar struggles, and it's just kind of a beautiful thing when you finally rip that band-aid off and you really do start healing because you're open about it.
It really is. And that's the stigma of mental health, that your family might see you as weak or your friends will see you as weak. And most people don't seek help because of that. And that's why it's important to know that when you are feeling like that, you have options. And to everyone who's listening to us right now, I want them to know that 988 saves lives.
Hmm,
So when you are in that dark space and you are isolating and you feel that there is no other options for you, please call 988. It's at no cost for you and it does save lives.
absolutely. That's a beautiful message this morning, and I can't thank you enough for joining me here and talking about this and the fact that it's okay to not be okay. It's totally and like it takes a strong person, right? Not a weak person to open up and
It
talk.
Mhm.
sure
I think
does.
that's the biggest misconception,
It
right?
is.
Hmm.
And then so real quick, I want to thank you for your transparency because I
Absolutely.
think that that's huge. Just someone being in your role that speaks to so many people on a daily basis. It's very important to hear that from you. So thank you for carrying the message. And also, I want to mention that asking for help is actually a way of strength,
Yes.
not weakness.
Hmm.
And again, it's like I think for throughout years and especially the Philly culture, like I was raised by a bunch of strong women that powered through things like from, like North Philly, let's power through. This
Mm-hmm.
is what we do, hardcore work ethic. So it was, also really hard to like really talk about things, right? And I think
Right.
that we see that a lot in generations in Philly culture.
I was gonna say that, like my parents' generation, yeah, it's like that. Like
Right.
we don't talk about the problems. We kind of just keep it to
Yeah.
ourselves, and that only works for so long.
Right.
Right. It works until it doesn't.
It works until it doesn't.
Yeah.
And
Yeah.
I think the main message here today is that it's totally healthy and okay to reach out, pick up the phone, call or text 988. Marjola, Patrick, Raquel, thank you so much for joining me here on this really important podcast. Thank you so much.
Thank you.
Thank you.
Thank
Thank you,
you.
Michael.
Happy
Call
holidays.
or text 988. It's okay to not be okay.
Opiate.